Lower back pain is a widespread public health issue, affecting millions globally and standing as the leading cause of disability in the United Kingdom. The personal and societal impact is immense, with the National Health Service (NHS) shouldering an estimated £12.3 billion in costs annually. As the prevalence of back pain rises, so does the demand for effective treatments. But with so many options available, how do we determine what truly works? In this video, we'll explore the use of steroid injections for back and radicular pain, examining their benefits, risks, and the latest research to help you understand whether these injections are a solution or a setback. Medical guidelines, such as those from the National Institute for Health and Care Excellence (NICE), recommend starting with conservative management for lower back pain. This approach focuses on rehabilitation, physical therapy, and strengthening the muscles that support the spine. The goal is to reduce pain and improve function without resorting to invasive procedures. Despite these recommendations, many patients still receive spinal injections early in their treatment journey. Understanding why conservative care is prioritized can help patients make informed choices and potentially avoid unnecessary risks associated with more aggressive interventions. Between 2015 and 2018, nearly 6% of patients with back pain in the UK received 3 or more spinal injections in a single year. This practice cost the NHS over £10 million. While these injections are common, the evidence supporting their long-term effectiveness is limited. Multiple studies have found that repeated spinal injections do not provide sustained relief for most patients. This raises important questions about the value and safety of relying on steroid injections as a primary treatment for chronic back pain. Randomized controlled trials, including research by Iverson and colleagues, have shown that steroid injections may offer short-term relief for some patients, but do not result in significant long-term improvements. In fact, both steroid and saline injections for lumbar radiculopathy showed no clinically meaningful effects over time. This finding challenges the widespread use of steroid injections and highlights the need for more sustainable solutions to manage chronic back pain. Steroid injections are not without risks. Complications can include infection at the injection site, bleeding, headaches, nerve damage, and even paralysis in rare cases. These potential side effects can be debilitating and may outweigh the temporary benefits of pain relief. Patients and healthcare providers must carefully weigh these risks before deciding on this treatment, especially when safer, conservative options are available. Collagen is a vital fibrous protein that forms the primary structure of connective tissue, providing support and protection to muscles. As we age, collagen production naturally decreases, leading to weaker muscles and increased vulnerability to injury. In degenerative disc disease, collagen type II is particularly affected, contributing to the deterioration of spinal discs. Maintaining healthy collagen levels is crucial for spinal strength and resilience. Repeated exposure to corticosteroid injections has been linked to increased collagen degradation. Animal studies show that multiple glucocorticoid injections can decrease enzymes needed for collagen production, weakening the connective tissue over time. Systematic reviews confirm that corticosteroids can reduce cellular proliferation, alter the extracellular matrix, and impede the body's natural inflammatory pathways, all of which are essential for tissue repair and recovery. Health of paraspinal muscles is critical for maintaining spinal strength and stability. Dysfunction in these muscles is commonly seen in chronic lower back pain. When muscles weaken or waste away, the spine loses essential support, making pain and disability more likely. Rehabilitation and muscle strengthening are therefore key components of effective back pain management. Glucocorticoids, the active component in many steroid injections, can accelerate muscle wasting. They increase the expression of proteins that control muscle breakdown, such as ubiquitin ligases. Additionally, glucocorticoids upregulate FOXO1, a factor that promotes muscle atrophy. Over time, repeated steroid exposure can lead to significant muscle loss, further compromising spinal health and function. Two types of cells are crucial for muscle growth and regeneration: muscle satellite cells and fibroadipogenic progenitor cells (FAPS). Steroids can downregulate MyoD, a protein essential for the regeneration of muscle satellite cells. This means that after steroid exposure, muscles may struggle to adapt to functional demands, making atrophy a serious and lasting side effect. Facet joint injections are another common intervention for low back pain. These injections target the small joints in the spine that can become inflamed or arthritic. While they may provide temporary relief, the evidence for their long-term effectiveness is limited. As with other steroid-based treatments, the risks of repeated injections must be carefully considered against the potential benefits. A 7-year follow-up study found that 83% of patients with massive prolapsed discs experience complete and sustained recovery without surgery. The body's own inflammatory response plays a key role in the regression of lumbar disc herniation. Macrophages, a type of immune cell, help break down and resorb herniated disc tissue, supporting natural healing and symptom resolution. Intervertebral discs are unique in that they lack a direct blood supply, making them immune-privileged organs. When disc material escapes its normal boundaries, the immune system recognizes it as foreign, triggering an inflammatory response. This process is essential for the natural regression of herniated discs and can be a positive sign for recovery. Corticosteroids work by minimizing the production and release of cytokines, key molecules in the inflammatory process. While this can reduce pain and swelling in the short term, it may also slow the body's natural healing response. By inhibiting inflammation, steroids could potentially increase recovery time and interfere with the regression of disc prolapse. There is significant variation in how often and how much steroid is used in spinal injections across the United Kingdom. Some regions report much higher rates of repeated injections, especially in areas without access to spinal surgery. This inconsistency highlights the need for standardized guidelines and better adherence to evidence-based practices. Despite clear recommendations, many healthcare trusts do not fully comply with current guidelines on the use of spinal injections. This widespread noncompliance can lead to unnecessary procedures, increased costs, and greater risk for patients. Ensuring that treatment decisions are based on the best available evidence is crucial for improving outcomes and patient safety. Long-term management of lower back pain with epidural steroid injections remains controversial. Questions persist about whether the benefits in quality of life, patient safety, and cost truly outweigh the risks. With high costs and limited evidence for sustained improvement, both patients and providers must carefully consider whether steroid injections are the right choice. Body's own inflammatory mechanisms can often lead to the regression of disc prolapse and the resolution of symptoms. Supporting natural healing through rehabilitation and conservative care may offer better long-term outcomes for many patients. This approach emphasizes the importance of patience and persistence in managing chronic back pain. Despite decades of use, there is still much to learn about the role of steroid injections in managing lower back and radicular pain. More research is needed to clarify which patients, if any, benefit most from these treatments and to develop safer, more effective alternatives. Ongoing studies will help shape future guidelines and improve patient care. For patients and providers, making informed decisions about back pain treatment is essential. Understanding the risks and benefits of steroid injections, as well as the value of conservative care, empowers individuals to choose the best path for their health. Open communication and shared decision-making are key to achieving the best possible outcomes. Summary: while steroid injections may offer short-term relief for some patients with back and radicular pain, their long-term benefits are questionable and their risks significant. Conservative management, including rehabilitation and muscle strengthening, remains the recommended first-line approach. As research continues, patients and providers should stay informed and prioritize treatments that offer the best balance of safety, effectiveness, and cost. Remember, the journey to recovery is often a marathon, not a sprint.